So you also can call this topic as how to avoid cardiologist or how to avoid cath lab visit. So all my talk is going to be a kind of a evidence-based medicine. So as you know, the evidence can change time to time. So I'm not claiming this is the ultimate truth I am going to tell. So it's up to you all to decide. I'll give all my talks. Everything is research-based talk. Okay. This is a very important quote by a person known as father of evidence-based medicine. Half of what you learn in medical school will be shown to be either dead wrong or out of date within 5 years of your graduation. The trouble is that nobody can tell you which half, so that most important thing to learn is how to learn on your own. As you all know, the non-communicable disease, the 70% of the death in the world is due to non-communicable disease. Mother of all non-communicable disease, I will say diabetes. A better term would be insulin resistance. The problem is, I feel we don't target the right enemy. So it's important to understand the root cause of the problem. Whether it's a cancer or diabetes or fatty liver or Alzheimer's dementia, the root cause is one. You'll understand in a few minutes. So understanding the right enemy is very, very important. We are fighting with the wrong enemy sometimes. When it comes to diabetes, we think treating the glucose is the ultimate goal. It is not. Treating the insulin as well, I mean, reducing the insulin and reducing the glucose is the right thing to do. You'll understand soon. So underlying problem for almost all non-communicable disease, whether cancer, asthma, diabetes, anything, the underlying problem is inflammation or heart disease, ischemic heart disease, due to oxidative stress. So the most important cause of this inflammation and oxidative stress is insulin resistance. I'll come to that. So when you keep an apple for a while, you know, it will become brown. That is oxidation. If you keep an iron rod, it will be corroded. That is oxidation. So similarly, in the body, when there's oxidation happens, it's oxidative stress, we get disease. Just similar to what happens in apple and the corroded iron. What we eat and what we think matters. So such as alcohol, smoking, bad food, which can cause oxidation and lead to disease like diabetes, cancer, ischemic heart disease, and so on. Even aging is due to oxidative stress. Dementia, Parkinson's, epilepsy, stroke, arthritis. The underlying problem is oxidative stress. What is oxidative stress? When you lose, you can see that one electron from an atom, it will become oxidate. It's a very active particle which causes damages. So if you give an extra electron to that ion, then that will be, so that is antioxidants. So the best medicine for oxidative stress is antioxidant. So this is one example I have given. The ischemic heart disease, the underlying problem is inflammation. Now coming back to insulin resistance. Many of you don't know, you think when it's insulin resistance pain, it is that causes diabetes. Insulin resistance is the cause for many diseases, including Alzheimer's dementia, cancer, heart disease, diabetes, polycystic, even low testosterone level in male, fatty liver, migraine, everything. The underlying problem is insulin resistance. How do you get insulin resistance? How do you get antibiotic resistance? How do you get nitroglycerin resistant with nitroglycerin? It is because of antibiotic, it is because of nitroglycerin. Similarly, there are enough evidence to show the the insulin resistance is due to insulin itself, or the important cause of insulin resistance is insulin. When we diagnose diabetes, that is too late. Nearly 10 years before you diagnose as diabetes, you have high insulin. High insulin itself causes insulin resistance. As per this, there are many research. Here in this particular article by American Diabetes Association says, in summary, hyperinsulinemia is often both a result and a driver of insulin resistance. It's very important to understand. Now, next question is, what causes high insulin? So, high insulin causes insulin resistance. At least one of the important causes of insulin resistance, insulin itself. Now, remember, when you treat a diabetic patient with insulin, you do good thing. Similarly, you do bad thing also as well. Now, there are enough link between high insulin and ischemic heart disease. It says the link is more stronger than LDL. Now, high insulin is associated with 3 times more cardiac deaths, 2 times more cancer risk, 2 times more risk of Alzheimer's dementia. Insulin is 40 times increase the risk of ischemic heart disease. So in diabetes or any of this disease I mentioned, if you think glucose is a problem, you are our mission will be failed, maybe 50% mission failed. If you think the insulin also a problem, then we'll treat insulin as well as glucose. The aim is to reduce both insulin and glucose. How do you do that? Not by giving sulfonylurea. In fact, I'm not telling not to give. So that by giving sulfonylurea, you reduce only the glucose. How do you reduce the insulin? The best way of reducing insulin as well as glucose is low carbohydrate, which increases the insulin. If you see, carbohydrate increase the insulin in a significant way, but protein and fat will not. So now we have enough evidence. Now before that, so how do you know you have insulin resistance? One indirect way of knowing that you have insulin resistance is checking the triglyceride. LDL, I will say why, is almost useless than what you call small dense LDL. I will come to that. But triglyceride versus HDL ratio, or triglyceride, if it's most of us are high triglyceride, particularly Asians, Indians, and Sri Lankans, we have very high triglyceride. So one way of knowing whether you have insulin resistance is checking your triglyceride. There are, again, the research evidence are there. Or triglyceride versus HDL ratio, it should be less than 2. So come to fat. There are lots of controversies created around fat. The story starts in 1960s by a biochemist called Ansel Keys, a biochemist. He is the one brought that he thought the fat is a cause for ischemic heart disease, and he did a study in 7 countries, and he proved that fat is a cause for ischemic heart disease. There are lots of controversies around this study. Some argue he had about 21 studies he studied in 21 countries, and he cherry-picked only a few countries, 7 countries, and avoided some other countries and proved, yes, fat is a cause for heart disease. So there are lots of controversies were there. So till 1960, we believe fat as a villain, as a cause for ischemic heart disease. Now I'm going to show several research evidence. Again, as I said, I am showing the research evidence. It's up to you all to decide, because research evidence changes. You know, with COVID, what happened? One day we say this is the best treatment. Next day they'll say this is the worst treatment. So it went on like that. The lots of conspiracy goes on when it comes to researchers, by pharmaceutical company, by food industry, and so on. So I don't think you should believe what I'm telling, but you should have a very open eye. But what my research evidence, I think almost all these evidence are from well-known top medical journal. Here one evidence shows that there's no significant evidence for concluding that dietary saturated fat is associated with an increased risk of coronary heart disease or cardiovascular disease. Another research published in British Medical Journal. It's a meta-analysis or systematic review and meta-analysis of observational study. There are always limiting factors. So this is from a British Medical Journal. It says it's a meta-analysis and observational study. Says saturated fats are not associated with all-cause mortality, cardiovascular disease or coronary heart disease or ischemic stroke or type 2 diabetes. Trans fats acid, if you want one very clear, there's without any controversies, we can say trans fatty acids are really lethal, such as in margarine. I think in America they have banned. So that is very clearly not good for heart. Another study, again, this shows there was a 22% high risk of death for each 0.78 millimole per liter reduction in serum cholesterol. Greater reduction in serum cholesterol had a higher rather than lower risk of death. Systematic review and meta-analysis of randomized controlled trials do not provide support for the traditional diet heart hypothesis. Another study, they replace saturated fatty acid with monounsaturated fatty acid. Again, actually the mortality increases. Sydney Diet Heart Study, a randomized control study, it says substitute dietary linoleic acid, I think it's a monosaturated acid, in place of saturated fats increases the rates of death from all-cause coronary heart disease and cardiovascular disease. These findings could have important implications for worldwide dietary advice to substitute omega-6 linoleic acid or polyunsaturated fats in general for saturated fats. Another large study, it shows nearly 48,000 participants, 8 years study. So when there's a reduction of fat by 10%, there's an increment of ischemic heart disease by 26%. This is the recent study of one of the largest study done in 18 countries. More than 1 lakh people were involved. It shows, look at this. I don't know whether you can see. The first 4 diagrams are for fat. It shows higher the fat, whether saturated, monounsaturated, polyunsaturated, lesser the deaths. Lesser, that's as per the research. But if you look at the last one, higher the carbohydrate, higher the mortality. The message is very clear. Again, it's evidence. At least the fat is not bad as we think, or maybe good. So, and carbohydrate definitely not a good diet. But again, carbohydrate means sugar is a carbohydrate, processed food is a processed carbohydrate is a carbohydrate. So we don't know what kind of carbohydrate in this research they are talking of. So at least the processed carbohydrate is definitely a not a good diet. There are 2 statements given by one of the largest studies done on cardiac in the heart, Framingham study. Before that, one author, important author, lead author of a nurses health study and the health professional follow-up study. He says, we have found virtually no relationship between the percentage of calories from fat and any important health outcome. One of the directors of Framingham study, he says, more saturated fat one ate, the more cholesterol one ate, the more calories one ate, the lower people's serum cholesterol. This is an article in the Journal of American College of Cardiology. I think each and every sentence here are very important. I will read for you. The recommendation to limit dietary saturated fatty acid intake has proceeded despite mounting evidence to the contrary. Most recent meta-analysis of randomized trials and observational studies found no benefit effects of reducing saturated fatty acid intake on cardiovascular disease and total mortality, and instead found protective effects against stroke. Saturated fatty acid increase LDL cholesterol in most individuals. This is not due to increase level of small, dense LDL particle, but rather large LDL particle, which are much less strongly related to CVD risk. Whole fat dairy, unprocessed meat, and dark chocolate are saturated fatty acid rich food with a complex matrix that are not associated with increased risk of cardiovascular disease. So now, you know, the popular diet, paleo diet or ketogenic diet, people almost reduce the carbohydrate almost to nil and they take too much of fat and protein. People think taking too much of meat may be good, and there are good effects. I'll show that. What I feel is just by removing the ketogenic diet or paleo diet works really well, not because you are adding meat or any other protein, but by eliminating or reducing the carbohydrate. These are some of the results. If you see, it reduces the weight significantly without any doubt. It increases a good cholesterol HDL. It reduces the cholesterol, it reduces the LDL, triglyceride, blood urea, and fasting blood sugar, but increases the creatinine a little bit. Recently, I went through a YouTube. I couldn't mention here the site. Very, very important message here. Now, if you look at this one, 2017, 2018, and 2022, these are the people. 200, look at this one at least. 224 people undergone a low carbohydrate diet. Out of that, 117 people, they were remission. That means no drugs, just simply low carbohydrate diet, cured, or the right term now is remission. Diabetic remission was observed. 52. If you look at in 2020, again 52% out of 203 people. In 2019, 48%. See, we are struggling. Nearly 50 out of 100, nearly 50 people were able to get rid of medicine. Just simple one medicine, low carbohydrate. When you give medicine, you can reduce the glucose. Some of them may reduce the insulin resistance, but it won't reduce cholesterol, any other thing. But low carbohydrate, it reduces your diabetes, it reduces your cholesterol, and so on, and cancer risks, and so on. So one medicine for many diseases, it's low carbohydrate. It is the way to go. I think now people are very reluctant to go for it because we are live with rice. Not only the same study, not only diabetes, the low carbohydrate reduces the creatinine. If you look at that, reduces the creatinine, protein, urine protein, serum cholesterol, HDL, increases HDL and reduces the triglyceride. It's not clear. So as I said, I think we can't blame just carbohydrate. If you see, the longest living people in the world is one of the areas, Okinawa in Japan, one island, where they take 80% or 67% of their diet is sweet potato. So they are taking unprocessed natural food. So this is very complex. Definitely carbohydrate play a major role. Probably the sugar and the processed carbohydrate is the culprit. So these are the people who live hundreds of years, I mean more than 100 years in Okinawa. Because sweet potato has lots of phytonutrients, antioxidant. Next, come to LDL controversies. Definitely what we see as LDL in lipid profile is not the right thing we do. I will tell why. There are enough studies to show, this is one of the, again, British Medical Journal, a systematic review shows high LDL cholesterol is inversely associated with mortality in most people over 60 years. They say higher the LDL, lower the mortality. In more than 60 years. Why is that? We'll come to that. Now, if you look at LDL, it's produced by our body with some purpose. It's needed. But when it combined with a glucose, glycated LDL is lethal. Oxidized LDL is lethal. That is what we call small dense LDL. LDL itself is not bad. Small dense LDL is bad, which we can't do routinely. So small dense LDL is atherogenic. So when you check LDL, we are not checking the right marker. So when it's oxidized, when the LDL is oxidized, it cannot be taken up by the liver or the peripheral tissues. So where will that go? That will go to the blood vessels and damages the endothelium. It goes inside and form the foam cell and atherogenesis. I think we should understand very clearly it is a small dense LDL which is bad. So we should not blame LDL. Similarly, we should not blame carbohydrate. It's probably the processed carbohydrate and sugar we should blame. Similarly, LDL, we can't blame LDL, but what we have to blame is the small, dense LDL. About statin again, there may be studies which may be contradicting what I am telling. This is from, again, British Medical Journal. They have been through 11 studies, more than 90,000 participants. What they have found is how much the statin, how much of months or years a statin can increase your lifespan. This is their result. When you have a cardiovascular disease, it increases the lifespan by 5.2 days. If you don't have a cardiovascular disease, increase your lifespan by 3.1 days. So again, I'm telling, this is from a British Medical Journal. If you read the discussion, they'll say there are lots of limitation in the studies also, but 5 days and 3 days, maybe some months, we can say it can't be years. So these things we should look into. So if you go by now, when they present the research, we go by risk reduction. That will cheat you. If I say statin has a risk reduction of 50%, that means it's like this. After 5 years, if you give 100 people 5 years, if you don't give statin, 2 will die, for an example. If you give statin after 5 years, 1 will die. So what is the risk reduction? It is 50%. It will cheat you. When you say 50%, it's a huge number. But if you say absolute risk reduction, it's only 1. Or number needed to treat, give a more meaningful answer. So if you see the journal, they have studied this also. When it comes to benefit, they talk about risk reduction, not absolute risk reduction. When it comes to side effect of the drug, they talk about the absolute risk reduction. So number needed to treat, if you see, for example, if you treat heart disease patient for 100 people for 5 years, if you treat 100 people, we can prevent 1 death. Statin, if you give 83 people for 5 years, you can prevent 1 death. Coronary stent during heart attack, if you do 40 coronary stent, you can prevent 1 death. But if you give Mediterranean diet, if you give right diet for 30 people, you can prevent 1 death. So this shows a significant importance of diet in heart disease. So what is a better solution? We talk about fat. It seems it's not too bad other than the trans fatty acid, which is human made. Anything made by human, you must be very careful. Anything processed by human, you must be careful. Natural things are not so. So we said carbohydrate, probably the processed carbohydrate is really bad. Fat, it's not bad as we think. Now, what is the so drugs also, it has its benefit. I do give statin. Somebody asked after my talk whether you prescribe statin. I'm giving, but I'm waiting for the guideline to change. Now, America, things are changing. They have stopped restricting cholesterol and the fat. So what is the best solution? You know, the problem is oxidative stress or inflammation. Why? Due to one electron and the free radicals. The best solution would be antioxidant. Where do you get the antioxidant? So you can divide food into 2, macronutrient and micronutrient. Carbohydrate, lipid, protein, you know, we have talked about it. The other side is the medicine given by the nature, vitamins, minerals, and phytonutrients. Now, most of you don't know, most of us, we don't know what is phytonutrients. There are maybe 10, 15 vitamins, 10, 15 minerals, and there are thousands of phytonutrients. It's a nature's medicine, antioxidant for most of the disease. I will give 1 or 2 examples. So what does it do? It donate one electron to the affected atom. So it's donate. That is antioxidant. I will give one or two very good examples. There are plenty. When you give antioxidant, how one way to deal with non-communicable diseases, eliminate the bad thing. That itself will heal. Second thing is add the right thing. That's what I'm telling here. This one is the one in the, he is a cardiologist, Professor Dean Onish. He is a cardiothoracic surgeon. I think he's Olympic medalist, gold medalist. So both of them did studies, almost similar study, two different studies. This is their finding. So here, angiogram, they did 32 months of plant-based diet without cholesterol lowering medication, showing profound improvement. Angiogram before the diet, after the diet. I think none of the medicine in the world can do it. Maybe statin can do a little bit as per some claim. So this is, I will say, miracle. So nobody talks about this medicine, but it has shown. But I'm sure people will disregard this, saying a small study or that and this. But this is one example. And same person, he did. He said he gave all plant-based diet to 18 seriously ill heart patients for 23 years. He's a cardiothoracic surgeon. And there were 49 coronary events during 8 years prior to the study. 49 events, 0 coronary events during the 12 years of follow-up. After the plant-based diet invention, there was 0 coronary event. Before that, there were 49 coronary events. And only one died of cancer. Instead of expected death is 8 to 10 deaths due to cancer. This is another study where it shows this is a esophageal cancer cells are there. They gave dried strawberry for 3 to 6 months. After, I think, 3 or 6 months, you can see how much of reduction in the cancer cells. That's all this thing. So in conclusion, I will say inflammation caused by oxidative stress is the underlying problem in many non-communicable diseases. Insulin resistance and hyperinsulinemia play a vital role in this disease. The successful treatment of diabetes and many other diseases requires addressing both glucose and insulin level. Saturated fats has not been proven to be harmful, and a low-fat diet may increase the mortality from ischemic heart disease. In the elderly, LDL cholesterol is inversely related to mortality and is small, dense LDL particles that are the true atherogenic culprit. Carbohydrates, particularly processed and sugary ones, increase all-cause mortality. Statins may only increase the lifespan by a few days. A diet rich in antioxidant is a powerful medicine.